Welcome to Pennsylvania in Focus. I'm Kristen Smith. Healthcare workers willing to work in Pennsylvania's underserved rural regions could get some help repaying student loans. This after the House Healthcare Committee renewed its drive to incentivize medical workers to live and work in rural areas amid a worsening labor shortage. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Christina, what is House Bill 157 and how will it improve recruitment and retention?
House Bill 157 is a bill that would give grants through the Department of Health to facilities in rural parts of the state to hire medical professionals, and part of the incentives to hiring those professionals would be that they would be reimbursing them for their student loan debt. So the facilities get up to $250,000 annually, which they can then apply to their employees' student loan debt. In order to be eligible for the program, people have to obviously move to the rural area of the state and stay in that position for at least 3 years, or else, they don't get that funding.
And explain the current healthcare landscape. Just how bad has it gotten?
It's gotten pretty bad. So the types of people who can apply for this grant, if it goes through, would be, or really it's the facilities applying for the grant, but the type of people that they can give the finances to are doctors, nurses, midwives, dental hygienists, and dentists. And we're seeing a real staffing strain in all of those areas across the state, but especially in rural Pennsylvania. There is currently about a 28% vacancy rate for nursing support staff and a 26% vacancy rate for registered nurses in rural hospitals. On top of that, we see only about 6% of graduates from Pennsylvania's dental schools going to work in rural areas. It kind of creates this cycle that gets really exacerbated because when you have fewer people working, people are stretched, they have to work more overtime. It's just a more stressful job that leads to burnout faster. People leave. And with that attrition, it's just really hard to even begin to close the gap. So the idea is to get more people to want to live and work there. And what you see when you see, less available resources like healthcare, you also see people who aren't in healthcare moving out of those kinds of areas because they don't want to live somewhere where they can't access basic needs. So ideally, if healthcare improves in the area, then they can start to work on the overall population crisis happening in our rural communities.
And what are the prospects of this bill?
So this bill is it's being put forward by Representative Rapp, who is the Republican chair of the Health Committee, and it's also supported by her co-chair, Frankel. So there's bipartisan support from the get-go, which is a really good sign. Also, this is an issue that everyone agrees is a real problem. And rural healthcare has been a major focus of the state for several years. So in that regard, it has good chances. This is a bill that has been introduced before, and it did not make it past the House floor. So for whatever reason, it wasn't picked up as a priority. I can't really speak to why that happens or if it will happen again, but in theory, it should be able to garner the support that it needs to pass.
Christina, thanks for joining us today. Listeners can keep up with this story and more at thecentersquare.com.